Hi, Professor Edwards. My name is Alessandra Straggi, and I'm completing this video as part of the requirement for the 495 capstone synthesis assignment. And I wanted to record this video so you could have like a face to a name. And I just wanted to talk a little bit about my transition from non-nursing to nursing, and then how I chose my program, and then my transition from the community college level to WSU and what that's been like. So I have worked as a nursing assistant for the last 5 years, simultaneously as a telemetry technician across a couple different organizations in Eastern Washington. And naturally, when I was applying to nursing school, I started asking the nurses that I work with, where did you go to school, 2-year versus 4-year? What do you think about the students that you precept? And so on and so forth. And so the kind of common theme, I think it's a long-standing really rumor that I encountered, was that, if you go to a 2-year program, you'll be a much more practical nurse, and you'll be ready to get out there and take care of patients because you get more hands-on time with patients, because in the 4-year programs, there are more, there's more homework, more book work, it's a longer program, and they're just more concerned with book work. And having gone through both programs now, I think they both have their own values. I think community college is a great starting point for a lot of people for various reasons, but I definitely believe that everybody should go on and get their bachelor's because there's just so much that wasn't covered in our program. I graduated in March of 2017, so here we are a little over a year later and about to have my bachelor's. And I have just learned so much about topics like population health and research and leadership and management that were just hardly grazed over in my program. And they're super critical because I think they really help me as a nurse see the bigger picture for my patient, aside from the individual patient laying in the bed and the care plan for that individual night. My decision for community college ultimately came down to cost and budget, and classroom size and kind of peers, kind of a couple things. I was 26 when I went back, and I started my first go around at college at a larger university and kind of felt lost, like I wasn't connected with my professors. And so I really felt very connected to all of my professors at community college. The class sizes were a little bit smaller, and the average age of my class was like around 32. So I feel like at that time in my life, it was really important for me to be able to relate to my peers. And the students that I saw kind of at the university level were a lot younger than myself. I graduated in March of 2017. I started my bachelor's in May. I have one friend that graduated the ADN program with me who has diligently been my partner throughout this entire program. And I am so happy that I chose WSU. When we were going to practicum quarter and people were asking about BSN programs, and I just feel like the depth and breadth of knowledge that the instructors at WSU have, especially as it relates to our community in Spokane, is just unmatched anywhere else. And the clinical sites that I was able to participate in have expanded my knowledge just tenfold. So enjoy the rest of the presentation. I did want to share with you, I found one statistic that I thought was really interesting. I had some recent conversations with classmates I graduated with, so we're a year out now, and they have still not gotten their bachelor's, and I thought that was the exception. But one of the studies that I found from Allen and Armstrong in 2013 says that nationally only 21.6% of ADN nurses are going on to obtain their bachelor's degrees. And so it floors me because a lot of the research I found says that by 2020 they want to be 80% compliant with that, and at only 21.6 we have so far to go. So I'm hoping that I can use my experience through the BSN program to really inspire some other colleagues and friends to kind of help us bring that number back up. Okay, so the first learning goal listed on the syllabus for course outcomes is that the nurse demonstrate generalist baccalaureate responsibilities in practice. And encompassed in this goal is working with patients across the lifespan and across continuums of healthcare environments, understanding variations of care, increased complexity, and increased use of resources to provide that care. It also emphasizes that clinical work should develop and refine the knowledge and skills necessary to manage care as part of an interdisciplinary team. So my time in the cardiac cath lab this semester, I feel gave me a genuine opportunity to work with patients across the lifespan, from pediatric through geriatric, as heart disease affects everyone. I think it's also important to mention that participating in discussion posts with peers also gave me an opportunity to collaborate and work with persons from different geographic locations and professional backgrounds. I feel like I observed interdisciplinary collaboration daily every time I was at clinical, between the physician, registered nurse, there's a cardiovascular tech, a radiology tech, anesthesia, and then occasionally an EP tech, or electrophysiology technician if they're doing ablations. But all of these people are involved in the case, every case. And so daily I was able to observe kind of what that is like to be part of that interdisciplinary team to provide care for those patients. I feel I was able to refine my pathophysiology knowledge in every case by looking at imaging and asking questions about different vessels. And working both inpatient and outpatient cases gave me an understanding of how complex some of our care really can be and the resources involved the further along we get with how complex the patient is. Some of our patients, a large portion of our patients would come in outpatient with maybe only mild coronary artery disease, but then we would have some patients coming from the intensive care unit that were intubated or were, placed on a balloon pump and then still needed to have these procedures done. So, and then on top of that, the emergent level ones that were coming in from the EMS system. So I feel like I was truly able to kind of see what care looks like across different complexities and what resources are involved in caring for those patients. So the second course outcome is one of my favorites, and it is using evidence-based documentation to support theory and practice. I feel this was consistently pursued throughout this course, primarily through the conceptual thread and clinical journal discussions, the further discussions with my peers in the course on those posts, but I feel like largely this was accomplished through conversations with my preceptor at the clinical site. A few examples of these evidence-based discussions that we had are like post-TAVR, trans-aortic valve replacement is what TAVR stands for. So post-TAVR pacemaker implantation, rates of that and how often that's occurring compared to like open heart valve replacement. The use of porcine valve versus a bovine valve for replacements. Cross-training cath lab staff, like the pre-op and the actual cath lab nurses, and then recovery nurses, so cross-training them, what the rates are on that, and then how much of that is actually happening to help prevent staffing shortages, and also just to improve like unit cost efficiency. And last, the side effects of patients who go on bypass, depending on how long they're on bypass for, because I was able to observe open heart surgery, and so what the complications are of somebody being on bypass, because there's no hard limit on how long somebody can be on bypass. It's just the rule of thumb I was told is less time is better. So I did some research on the neurological complications that can come from going on bypass. And then lastly, the increasing use of quick clot powder in following radial heart caths to prevent radial artery occlusion and complications from that. So all of these conversations with my preceptor Edna daily really just led me to go home and kind of trove through the databases to find the evidence-based research that's out there and then bring that back and kind of have a discussion with her about my findings. And I think that this was well reflected in my evaluations from her and actually was one of my favorite parts of clinical, all the conversations that we had about the complications and topics that we were seeing in practice. The third learning goal listed for this course is to evaluate personal and professional performance and learning outcomes through the RN BSN program. For this course specifically, this was largely completed through achieving my clinical objectives that I wrote out prior to beginning at my clinical site. I challenged myself by working in a very different environment, very sterile, highly controlled, with a high level of care and chance for life-changing errors, which is very different than my primary work in neurotele kind of med-surg advanced care unit. I consistently pursued communication to increase my knowledge and deepen my understanding of interdisciplinary communication. I drew on past classes like Nursing 440 when it came to working with diverse populations. Nursing 479 Advanced Pathophysiology was an elective, and that helped to deepen my understanding of the coronary processes that I was seeing in these patients. My biggest takeaway from the program that has helped me the most is from Nursing 400, the evidence-based research class, as it taught me not only how and where to find evidence-based articles on topics I was interested in, but how to evaluate the statistics and findings for credibility. So just because something is at the top of the pyramid as a systematic review or a meta-analysis, those can still be done poorly, and that was my biggest takeaway from 400. Nursing management in 405 and 406 kind of helped me to identify, utilize, and evaluate the different forms of communications being used in the clinical setting. So top-down, horizontal, diagonal, grapevine, all those different forms of communications that exist. One of the articles I found from Ann Bari in 2015 discusses how these specific courses in research and leadership and community health really help elevate the bachelor prepared nurse. So they say that community health courses help broaden the concept of the patient, and leadership courses help the nurse view their leaders and managers in a different way, and also arm them with different ways to approach management with their own ideas or issues. And then for research courses, they go on to say that it increases the nurse's desire to investigate and use evidence-based practice in their own work and helps empower them to conduct their own research. All of this has elevated me from the already curious person that I was to an even more curious person, but armed with the abilities to find my own answers and to help refute things like sacred cows that I'm seeing in my workplace and in clinical practice. Somebody says, we've always done it this way. Well, it was never really sufficient for me, but now I can go back to the drawing board and say, this is why this is not sufficient. And this experience also gave me practical help, as the floor I work on cares for post-stent patients, and I can now be a better nurse for those patients and for my colleagues with the knowledge that I've gained. This practical help is in line with an article from McIntosh, Sela, and Thomas in 2016 that stated that research results reviewing patient care outcomes with baccalaureate nurses, showing a reduction in heart failure mortality, decubitus ulcers, failure to rescue, post-op DVT and PE, and shortened length of stay overall. For the WSU learning goals, starting with creative and critical thinking, those were initially fostered in 400 and 440, beginning with the pre-course evaluations on my overall confidence with evidence-based research and practice. Throughout the course and the completion of the PICO question, along with my two major papers in 440 on population health concepts, I really developed and refined my critical and creative thinking skills. I feel I did these through identifying appropriate databases to find information, and then by following the outline criteria in our textbook for evaluating validity and credibility of the sources of the articles and studies. I think it's also important to note that each time a course reflection was offered, that this was also a chance to bolster my critical thinking, as it really caused me to reflect on what I had done well in the course, what I had taken away from it, and how I thought I could improve for the next upcoming semester. I should also mention that advanced pathophysiology challenged my critical thinking on physiological processes far beyond any course I've ever taken. And I feel I developed a large portion of my creative thinking from all of the projects assigned in my 365-66 course. as we not only had like standard quizzes, but also group presentations and worksheets, which involved really thinking outside of the box on how to present those. And I think that this project right now is a great example of my enhanced creative thinking, as I chose to produce a video instead of a standard paper. For scientific and information literacy, to me, that means finding information, evaluating it using scientific and research criteria, and how to responsibly use and share that information. I feel this was completed in the PICO paper, as it was focused on choosing a topic, finding information, evaluating credibility and validity, and then sharing that on a larger scale with my peers and instructor. On a smaller note, I feel all of the conceptual threads and clinical journals required me to perform the same process and share with my peers in discussion as well. Communication was consistently pursued and achieved through written communication, every class through discussion boards, and then clinical really provided me the chance to observe both verbal and nonverbal communication, and not only for nursing, but pre-hospital communication and interdisciplinary in the cath lab. I performed 100 hours for my community health rotation with AMR and was able to observe multiple communication across the continuum there between EMS and patient, and then EMS and emergency room staff. There was a lot of nonverbal communication used between paramedic and EMT, and watching their relationship, their working relationship together, and how that affected the care that was provided to their patients, if it was a good match or a not so good match. And then the nonverbal communication between EMS and patient, as everybody in Spokane uses EMS. So people that can communicate verbally, non-verbally, with Parkinson's, with mental health hallucinations, and then also just non-English speaking. So there was a lot of, smiles, no crossed arms, just those really general nonverbal principles that everybody can follow to achieve baseline communication potentially with somebody. And then in the cath lab, I feel I was able to practice communication specifically for a safety event when I saw the stopcock was not closed on an arterial line, and so a patient was bleeding off to the side of the table, and I was able to speak up and say, I think that something is wrong, that line is not closed, before the patient lost too much blood. And I was also able to witness some really sincere, empathetic conversations between the nurse and the patient in the cath lab setting about pain control and comfort as it related to conscious sedation being performed. One article by Edie et al. In 2017 stated that communication skills, empathy, and non-judgmental person-centered care are highly wanted and valued nurse qualities by users of health services, and I feel like I was witnessing that between the nurse and the patient when those sincere conversations were happening and how those patients were responding to the nurse. Another article by Baxter, Jack, Feff, and Plogue in 2013 mentions that nursing academic programs oftentimes aren't able to provide a large amount of time for students to practice interdisciplinary collaboration and communication, and that a lack of confidence in this area can negatively impact nursing practice for new graduates. In our programs, I think we're afforded the best that we are through simulation and the proponent of SBAR and AIDIC communication tools. I think these do help bolster confidence, but I feel the majority of confidence in this area comes from clinical and working. For depth and breadth and integration of learning, I'm going to begin by synthesizing what I learned about heart cath procedures and sharing it with my colleagues and patients. I already use what I learned from my ACEs study paper in population health to take care of my patients and assess for childhood trauma and how that could be impacting their current health practices. I'd really like to integrate the information that I learned from the ACEs study, like the fact that as ACEs increase, so does the risk of conditions and behaviors, including depression, liver disease, alcoholism, smoking, and ischemic heart disease, and that for each of the categories assessed on the ACE evaluation, with the exception of one, there's an associated 2 to 4-fold increase in the likelihood of illicit drug use by age 14, and associated increasing risk with age into adulthood. I'd really like to incorporate that information and share it with my colleagues because being in Spokane, we do have a high incidence of meth use and heroin use. And I feel like if people knew more about the ACE studies and assessing for childhood trauma, that maybe they could identify some of those links earlier in their care for that patient and maybe help dispel some negative attitudes about drug seeking behaviors or even just behaviors and attitudes around patients who use drugs and how that impacts the care that's being given. As mentioned before, I plan to use what I learned in 400 to help dispel sacred cows in clinical practice and invite evidence-based practice discussion into my workplace. And I plan to integrate what I learned in management about communication skills into conversation that I have with coworkers, physicians, and management, and also hope to integrate what I learned about delegating to ancillary staff to help develop more confidence in that area. And I'm sorry my cat got into this frame. I'm so sorry. For the College of Nursing outcomes, I chose to focus on professional values and role development as I feel these are most applicable to my learning process in this program. Professional values were listed on the syllabus and encompass things like providing compassionate, ethical care to individuals from diverse cultures, values, belief systems, and lifestyles, and demonstrate values central to the nursing profession like altruism, autonomy, advocacy, human dignity, and also to protect the rights of our patients to receive information to make informed decisions. Both clinical experiences with AMR and the cath lab allowed me to work with persons from all different backgrounds and ethnicities. For Spokane, AMR is the only emergency system available, so if you need emergency treatment, you'd likely ride with them, or life flight if it was a helicopter. But we cared for all kinds of patients, non-English speaking patients, people who don't use healthcare regularly, pregnant women, trauma victims, death, non-emergent calls, and oftentimes going to people's homes and finding them in their homes in states of not well condition, unable to have cared for themselves. So at times it was very challenging to provide care to these individuals, protect their human dignity, and advocate for them at the same time that help is a good thing. I was also initially surprised to see in the cath lab setting pediatric heart caths taking place aside from congenital defects. But one of the articles I found had stated that 20% of youths aged 6 to 19 years of age have at least one abnormal cholesterol measure, and about 28.5 million adults ages greater than 20 have serum total cholesterol greater than 240 with an 11.9% prevalence rate. So thinking that only aging persons have heart problems was totally not accurate. The American Heart Association also predicts that by 2035, greater than 130 million adults, or 45% of our population, are projected to have some form of cardiovascular disease. So getting the information ready for those people and helping them really make informed decisions related to the cardiovascular care is going to be huge. Also, I feel like through researching the topics like post-TAVR pacemaker implants, side effects of bypass, and differences in valve materials, by researching those, and I can help my patients make more educated decisions about those as it relates to their treatments. Role development, it involves in the syllabus upholding the standards and values of the profession, including accepting responsibility for learning and personal growth, interpreting professional nursing using past and present trends in nursing and society, and advocating for humane health policies, among other things, but these ones kind of stood out to me. Continuing my education by getting my bachelor's was a huge step in role development for me, and I feel for my learning and personal growth. I plan to continue that moving forward. But also in my Nursing 406 class, I learned about different organizations to help support my nursing career and knowledge, like the Washington Center for Nursing, American Nursing Association, and WSNA websites and the events that they host for continuing education and relevant topics like workplace violence and incivility and safe staffing that are very pertinent to what we're dealing with now. Through my 405 leadership coursework, I was able to learn and hone my necessary skills to carry with me to my workplace, where I have taken on additional responsibility as a wound care representative for a floor. I also plan to use from what I learned in 400 to help our wound care team identify and implement evidence-based practice relating to wound care, not only for our floor, but also house-wide for our hospital. For the AACN Baccalaureate Essentials, I chose to focus on professionalism and professional values, as I feel that these are the cornerstone of our profession and fundamental, along with autonomy, altruism, integrity, advocacy, and social justice. I've always believed in patient autonomy pending capacity, and I was really able to apply and practice those principles of autonomy and social justice in my healthcare ethics class this semester. We had multiple discussion boards on challenging patient situations, like violating patient autonomy for the greater good or for their health due to capacity, or what to do when medication mistakes occur, where to lay fault and blame, and how to prevent those. I feel like these situations really helped push me to further understand advocacy and social justice for my patients. We also learned various ethical theories and how some are born out of altruism and helping others, and how some are born out of duty and doing the right thing and doing your job. And I really appreciated learning both of those because it helped me understand some perspectives that maybe I didn't see before. The other essential I chose is interprofessional communication and collaboration because it never loses its value. The clinical experiences allowed me to communicate and work with outside agencies. For example, while working with AMR, I worked with paramedics, EMTs, firefighters, nursing homes, mental health facilities, and emergency room workers. I was able to observe the communication and the scope of practice and what role each of those groups or organizations or individuals played in the continuum of care for the patient. In the cath lab, I worked with nurses, radiology techs, CV techs, EP techs, physicians, device reps, and countless others to provide high quality care to cardiovascular patients. That article by Baxter, Jack, Pfeff, and Ploeg in 2013 contends that interdisciplinary collaboration is important in promoting safe and quality healthcare to reduce morbidity and mortality, and they also suggest that investing in interprofessional collaboration can enhance recruitment and retention of nurses. The RN to BSN conceptual thread that I chose to talk about is one that's really been important to me since the beginning of the program, and that's been the fostering a spirit of inquiry. I have always interpreted it to mean a genuine sense of inquiry being fostered, either started or strengthened within each student, either from something that we were taught, read in a textbook, or a discussion post, or just a topic learned at clinical. I feel like I've always had an insatiable appetite for knowledge in that I'm constantly reading, looking for new information, reading studies. I took an extra elective course each semester just to enhance my learning, and truly feel like my learning is never over, like I'm going to be a lifelong student. And one transformation that I experienced in this RN to BSN program is that not everybody is that way, and that it's a good trait to have, and that this program really reinforced to me that this behavior of constantly seeking information and evidence-based practice is a positive trait within myself, and that I should continue it and try to inspire others where I can with it. So for the conclusion, I'm going to answer the two questions. So first, how have I changed? People ask me this frequently, whether it be previous classmates who have not gone on, or classmates actually in other online programs, or colleagues that have not gone on to do their BSN yet. And I believe I have made rather huge strides in learning about research and population and community health, primarily because those topics were not covered in my ADN program at all. One study that I found by Cheng, and Tsai in 2013 stated that nursing students' attitudes towards research in the beginning is usually pretty negative, but more positive at the end, and I fully agree. As excited as I was to learn new things and talk about topics that interested me, like stroke and infection rates and things like that, it was incredibly challenging to learn how to critically appraise research and everything that goes into that. And there was so much about research and finding evidence and types of evidence I didn't even know existed. But by the end of the class, I was feeling empowered, and I still feel empowered today, and strong in my abilities. And I carry that in my own practice and really in my life. Every time I hear something, I'm like, well, where did you get that information from? Just kind of challenging people, myself and people around me, to think about where they get their information from. I learned relevant topics in my population health course that apply to my everyday work, like food deserts, socioeconomic disadvantages as they relate to health, and ACE scores with chronic conditions and illicit drug use. An article by Bacon, Evans, and Randolph reported that bachelor prepared nurses tend to embrace population health concepts and actively begin finding ways to apply those to the acute care setting, which I think is huge, because we all know that we don't have enough social workers, and the ones that we do have are probably underpaid and really always pressed for time. So having us as nurses be aware of community resources for our patients as we prepare them for discharge can kind of help fill that gap. And the same article goes on to state that with rising rates of chronic conditions, emerging infections, and a growing need for disaster preparedness, that there is an increasing need for nurses who are prepared to transition from individualized nursing care to the care of population, which is what I feel like I really gained from this program. I've also gained confidence in myself because my classes have prepared me with not only knowledge, but how to communicate with others in various contexts of conversation. I don't have the seasoned years of experience that some of my older colleagues do, but I no longer feel discouraged by that because I understand how to find and utilize evidence-based practice to support my practice. Moving forward, I plan to continue my education through continuing education events and classes and courses over the next year, along with courses at the university that interest me, like genetics and physics. I will participate with our Wound Care Association and Unit-Based Council to try and take on a little bit of a leadership role and bring about evidence-based changes to the unit I work on, and engage colleagues in evidence-based discussion where I can. I also plan to continue recommending students at the community college level to continue on to WSU, as I serve as in an alumni representative role for their nursing club and network with their students fairly frequently. This program, while challenging, frustrating, and downright exhausting at times while trying to maintain the work-life balance, has really changed my life. And I'm about to realize my lifelong dream of having a bachelor degree, which is something no one in my family has accomplished before me. And I hope to really put it to good use in the future through the aforementioned ways that we discussed already. So thank you for your time, and thank you for your education this semester.